Hi everyone, I'm Urviska Kalia, the counseling psychologist and founder of Imperfect. Today I'm going to answer a question which clients ask me either before beginning therapy or in the first couple of sessions that we have. And the question is, what determines how long therapy lasts, or how long am I going to take in therapy, or how many sessions am I going to need? So there's a few factors, in fact, that influence how many sessions you might require as a client or how long therapy will last as a whole. And I'm going to talk about them in today's video. The first factor is the approach or the therapeutic framework that the therapist uses or operates from. Some frameworks are relatively long term by nature, and others are relatively shorter term by nature. So, depending on what framework the therapist uses, that could influence the length of therapy. It's important for you to consider your own preference of the therapeutic approach and ask the therapist before you begin therapy with them what approach they usually adhere to so that you can make an informed decision. Another very important factor is the nature of the concern that the client brings to the therapist or to therapy that the client wants to address, whether it's a relatively long term problem in itself, or the concern could be relatively long term. It could have been going on for a while, and that may require a longer term approach, whereas some concerns are of a shorter term approach nature and would require a shorter term approach, therefore. It also depends on whether the client would like to explore the causes of the problem, which again would require perhaps a more longer term approach because it would require going deeper into not just the cause but other factors which might have led to or influenced the concern or the problem occurring. If you would rather prefer focusing on the perpetuating factors of the problem, which means what are the factors that are currently keeping your problem or concern in play, what's making it perpetuate and continue rather than just end and change. If that's an approach you want to use, a relatively shorter term problem and solution focused approach would probably be more helpful. So think about which approach you would like to take and choose a therapist accordingly. Another very important factor, which we do talk about a lot, but I'm not sure clients take seriously enough, is the severity or intensity of the problem at the time that you're seeking therapy. So, if you're seeking therapy when the problem is unmanageable by you, which means it has grown in severity and intensity so much, and therefore you seek therapy, that means that the problem might take slightly longer to resolve or to work on or to address because you're already very deeply involved in the problem and it's very severe. But if you come when there is lesser intensity or severity, which means when the problem is initially beginning or just starting, you'll probably need fewer sessions. Therapy would last for fewer sessions for shorter time because you would probably be in a better space emotionally, mentally, psychologically to address the problems in a different way. Another factor, which in fact we don't talk about enough, is the internal and external resources that a client comes in with when they come to therapy. So we have various numbers of internal and external resources, which we may or may not even know, which your therapist will and should, in fact, help you explore and use those as well. So the greater level of internal and external resources a client comes in with, that's going to help you get through the therapeutic process fairly quickly. Self determination, commitment, and drive is another factor which will determine how long therapy will last for you. If you're highly determined, very committed, and driven to be involved in the therapeutic process, obviously therapy will probably progress faster than if you are less involved, less committed, and less determined in the therapeutic process. This will also determine how much and how well you engage with the homework and reflection tasks that the therapist either gives to you or just reflection in general, which you might do between sessions. whether it's simply just thinking about what you've discussed, what it is that you want to discuss in future sessions, how you're going to apply it, if you're going to apply it, etc. The more you're involved and engaged with that, the quicker therapy is going to go, because at the end of the day, the purpose of therapy is to use what you've learned in therapy in the outside world, not just in the therapist's clinic or not in that 1 hour that you're spending with the therapist. One major thing, and this is actually an upcoming thing that's come up recently, is the client and therapist mindset and the expectation of how long therapy is going to last. So if you have an expectation that therapy is going to last 24 sessions, then it probably will. Whereas research has found that if the therapist and the client expect therapy to have an impact even in one session, it probably will. Now, that doesn't mean therapy will end in one session, but that does mean that you can be helped in one session. And this is according to an approach called single session therapy, which I also practice. And you can see another video that I've done on that approach, or you can refer to my website and read more about it. So these are the various factors that are going to influence how long you might need therapy or be in therapy. Again, because there's so many factors, it's a very complex question to answer from your therapist. But these are the things that you can consider in order to determine how long therapy might take for you. That's it for today. If you've liked the video, do like, share, and subscribe. That's helpful. Thank you very much and stay safe.